Hello, my name is Jay Banerjee and I'm a consultant in emergency medicine at University Hospitals of Leicester and NHS Trust. I'm very interested in the care of older people, and in the emergency department, one of the really important conditions we see that older people present with is confusion. However, it's important to remember is that confusion is not a part of the aging process. So if somebody comes with confusion, either it's because they've got pre-existing dementia and now they have actually developed delirium, or it's a new presentation of delirium which can go on to develop dementia in the future. It's really important we think about it and we don't miss it, because it has been shown that when we miss it in the emergency department, 90% of the time it's missed elsewhere in the hospital. So expecting our colleagues to pick it up when we have missed it may not necessarily be the best strategy to take for these people. It's also important to think about the fact that it has actually got considerable impact on administrative things such as length of stay and delayed discharges. However, from a person perspective, it's also really important because delirium is a medical emergency, and if we don't identify and treat the underlying causes, it actually kills people. And if it hasn't managed to kill the person, it actually causes lots of other morbidities, including persistent delirium, pressure ulcers, infections, dependency, increased risk of subsequent institutionalization, prolonged hospitalization, and of course all of those leading to death. So it's really important to think of all of those. When we are thinking of delirium, it's really important to screen for the condition in people at least above the age of 85, ideally above the age of 75 in the emergency department, because the prevalence of dementia and therefore subsequently of delirium increases in this age group. But the people particularly important to look out for are older people with hip fractures. So delirium typically is precipitated by different things on the background of a predisposing set of conditions. Old age is the biggest predisposing condition, along with presence of dementia. When we're trying to manage delirium, it's really important to bear in mind that managing the behaviors needs to be part of a bigger package of managing the condition causing delirium in the first place. Otherwise it can cause more harm to the patient. So it's an important thing. We need to screen for it in the ED, we need to identify it, and we need to address it, or it causes significant morbidity and mortality for the patients.